Let's now talk about the situation in the United States, because today Donald Trump will be meeting with drug makers at the White House, and these talks, well, they come on the heels of a second death from the virus in Washington state, and there are now fears that the disease may have gone undetected there for weeks. Let's bring in Laura McQuillan. She has more on this story. So let's begin with this latest death, the second in Washington state. What do we know?
We know this was a man from a nursing home aged in his 70s, and the fact that he was in a nursing home raises a lot of worries. Now a lot of people have been falling ill there. We're hearing about dozens of cases, and so many of those residents in that rest home are being tested to see if they do have coronavirus as well. A lot of concerns about elderly people, people with pre-existing health conditions who could be more susceptible to coronavirus. Now, his death comes just a day after another one from the same community, a man treated at the same hospital in Kirkland, Washington state. And we're hearing that these cases could be just the tip of the iceberg as the number of cases in Washington state grows. But in fact, officials saying that cases may have been circulating there for 6 weeks so far. The number could be far higher than what has been reported. They have genetically sequenced the coronavirus in Washington state and found that patients who would have had no contact have the same strain. So they do estimate possibly hundreds of infections in that state. At the same time, the first confirmed case in New York City, a woman in Manhattan who recently returned from Iran. That's causing concern there, though officials do say the risk remains low in New York City. The first case is popping up in Florida, which has declared a public health emergency, Rhode Island on the weekend as well. All of this coming amid 24 new cases over the weekend, and officials saying that, it could be much worse than they believe. There are 89 confirmed cases in the United States so far, but if what we're hearing in Washington state is correct, that number could explode in the days to come.
And that is, of course, worrying many people, not only in the United States, but beyond. So let's talk about then the protocols in the U.S., because they're changing now as well.
That's right. So testing had been quite restricted. It was people who had a travel history, who had been in contact with someone who may be at risk of coronavirus. And that's, of course, how that one California case of human-to-human transmission slipped through. Someone who went without a test for days because the Centers for Disease Control and Prevention refused to give them one. In the end, they did get that test and it was positive. So now the Food and Drug Administration has announced it's going to let laboratories and hospitals use their discretion across the United States to carry out these tests. In the meantime, however, not all states have test kits. Some of those test kits don't work, so they're having to restock these, get more on shelves, get them into labs so people can use them. That should speed up the way they're detecting these cases and also help them identify these clusters like what we're seeing in Washington state. But again, the United States already feeling like it's on the back foot in terms of containing this. It's going to be crucial for them to figure out where these clusters are, how they can contain those. As you mentioned, Donald Trump meeting today with pharmaceutical executives worried about drugs coming in from China because of what China's been experiencing with coronavirus. So many concerns, lots of focus on the United States right now and how the administration is going to handle this.
Okay, Laura, thank you for that. Well, let's now look at the global picture, because the coronavirus did hit another grim milestone today. The number of deaths worldwide, it is now surpassing 3,000. China does remain the worst affected country with over 80,000 cases. And while there are more than 9,000 cases in almost 60 other countries, South Korea has the highest number of cases outside of China. That currently stands at almost 4,500. Iran now has the most deaths outside of China, standing at 54.